Today we have with us Dr. SADAF ULDE, BHMS Fellowship in Psychiatry, Director, Health Satya Foundation and Binary Intuition, teaching faculty at the Othersong, Mumbai with 13 years of experience. And the subject is Scope and Limitation of Homeopathy in Psychiatry with Case Demonstration. On behalf of IFPH, I am welcoming Dr.
Welcome everyone for this another session on psychiatry. So we have done few sessions before about the same topic. So yes, this topic is very important, and what I'll do is I'll recap with y'all what we have done in the past, and then take you to the topic of today: the scope and limitation of homeopathy in psychiatry. The first overview from past session. In initial sessions, we saw what Hahnemann guided us in treatment of psychiatric diseases. You can go through the previous video links from Dr. Danesh, and if anybody has missed, but just to give a fast recap, we knew Hahnemann classified mental disease into one that is completely one-sided, where only the mental disease are so strong that it takes over all of the bodily symptoms and mental symptoms are predominant. Then he spoke about physical corporeal disease which impacts mental health, like long-standing illness like cancer, autoimmune disorders, okay, or any acute illnesses. For example, the most relevant today world is the impact of what COVID had on the mental health. Okay, so a long-standing illness and its impact on body. Then acute mental illnesses like insanity or mania. According to DSM-4 criteria, diseases like acute schizoid attack, psychotic attack, or acute depression, mania, panic will come under these categories, where the insanity or mania comes in form of a very acute onset with an acute cause. Like for example, I remember when I was studying with Dr. Sarkar, and he will show some series of cases back to back. And one of the very frequent cases he will show us was of some newly married females who will go into a very hysterical attack. Okay. And he will say, see, this is the exact picture of Ignatia. Something happened, and then an immediate effect, and the immediate effect is hysteria. So that's how he will teach us a lot of materia medica with relations to keynote symptoms. Okay, so this became the, like, also he will show of some cases where somebody has passed off in family and they will come with some acute physical symptom, faintness and convulsions. So these are something which we say the acute effect of sudden emotions like fright, vexation, disappointment, grief. Similarly, nowadays we are living in world where substance abuse has become very common. Okay, the youth somehow find it very cool to get involved into weed or any kind of drugs, and they find it to be very attracting. Okay, and it is a way of venting. Some of them say it's a spiritual experience, etc., etc. But the drug abuse and its impact. So we also have homeopathic remedies, like we have cannabis indica itself, which is used to impact the mental impact of the drugs. I remember one case of a very young child who came to me after several days of continuously he was having cannabis. Okay, he was smoking weed, he was smoking pot, and he came and he told me he has this varied delusion that everything is just very slow. He's flying, he's meeting Lord Krishna, and there's a conversation with the god, etc., etc. So it was a very blurred state. So things that cause, so what I did in that case was, things that cause illness can also treat illness, and we know that we have cannabis indica as a remedy. So he had over smoked cannabis material dose to impact, to antidote the material dose effect. I gave a potentized cannabis indica, and this person immediately came back to the sanity. So this is just an example. There could be some other remedies also indicated. But in insanity or mania cases, Hahnemann suggested that you take that one particular um, acute totality and then treat it accordingly. Of course, we also have the chronic miasmatic background that we could take in picture in a very chronic case. Okay. Then the second session, we saw about postnatal depression and we focused on this one particular illness. Today, I want you all to understand the mental health. Okay, we as physicians, we think mental health is only big disorders like OCD, psychiatry, schizophrenia, psychotic attacks, depression, bipolar. But we also have to understand that sometimes the patient coming to us may not fit into this DSM-4 criteria of this illness, but is impacted by mental health. It's a positive concept. Okay, it encompasses your emotion, your psyche, and your social interaction. Okay, this is very important that we understand that today we are living in the world where there is so much bombardment of things, the positive reinforcement, the negative reinforcement, the bombardment of knowledge that somewhere or the other is impacting people's health both physically and mentally. So today we'll look at what are the mental health challenges in youth, how homeopathies and therapy can help them. Okay, so the first thing that in today's world is most important is validation. We all know the story of Snow White. The queen will look into the mirror and will ask, mirror, mirror on the wall, who's beautiful of all? Okay. But today, we are not restricted to the mirror, the whole range from Facebook to Twitter to Insta, continuously we are surrounded by mirror and we are looking for validation. Okay, and this validation has so much been impacted that somehow the self image is getting hampered. Okay, and this is the major reason of a lot of mental health issues coming up. Either the people are going into this criteria where they have very poor self image, okay, or they are going into the criteria of being too much into the self image and going to a level of being narcissism. So we are seeing a lot of narcissism rising. Okay, narcissistic people are rising because there's so much of me, and projecting your life and your lifestyle to be better than the others, and then the likes and the comments that are adding to the narcissism, or they're having a very negative impact where somebody can literally feel shit about themselves. Okay, so this aspect I have seen very closely with the youth. Okay, has impacted mental health, and this could be the major reason why they take up to substance abuse, they take up to a lot of drug abuse for cosmetic purposes. Like if you go to the gyms, they are constantly selling supplements. Okay, some of the supplements can impact the cardiac health. We have heard many stories, a very healthy personality running on the cardio machine and had a sudden cardiac arrest. Why do you think that's happening? The extreme of diets, extreme of beauty standards that has been created, and the use of uh, a very what you can say is non-therapeutic use of certain supplements. Who supplies the supplements to these youth? They are not doctors, they are not dietitians, they are not qualified physicians. They are simply 10 failed gym workers. Or somebody might be a BSc graduate or a BCom graduate or a BA graduate with no medical background. And somehow people take these supplements from them. They may not respect a doctor giving a supplement. They'll ask question a doctor, do you think this is work? Do you think this is having any impact? As a homeopath, when we claim to be of no side effects, still you will have people questioning you. Despite the degrees, the qualification, people will come and question you. How do you think homeopathy works? I think it's just placebo. I think it is having some side effects. Arsenic is the compound in your homeopathy. You are using aurum, you are using metals. Bhai, what are you taking in your gym supplements? Have you ever questioned that? Have you ever questioned the actors and actresses who are promoting vaccines? We don't question that because that's coming from the media and we are accepting it very casually. Okay. So, somebody who's non-medical background, non-scientific background is easily accepted just in face for having this mirror on the wall. So now they are promoting a different cosmetic therapies like dragon facial and which facial, I don't know what all facial, where the celebrities go and they do a lot of stuff on their face, which includes bloodletting and a lot of harmful steroids, botox, etc., where people are okay with it, because it's going to look beautiful, and they end up into physical illnesses. So why do they end up into the cosmetics business? Why the cosmetic business sell? Because of low, poor self-esteem that people carry. And why is this happening? Because a lot of social impact of the media world. Due to the impact of the media world, we are looking for validation. We are looking for likes. We are looking for comments. We are looking for followers. You are looking for name, fame very quickly without doing much of the work by just posting pictures on Instagram. And all of these media world that we think is so important can lead for trauma. We have higher expectation for ourselves. Women will look at models, beach models, and think they should have that skinny body. Okay. Men will look at that six-pack man who might be doing nothing but just giving his time on gym and just pushing in a lot of drugs into his system. So we have generally higher expectation on our body because there's a lot of body shaming. You go to a marriage, you have gained weight. Oh, you have lost weight. Oh, you have become dark. Oh, you have become fair. So there's a lot of body shaming that surrounds us every now and then without understanding that people are going through life stages and processes. A woman who goes through pregnancy is going to gain weight, will have some cosmetics here and there, but that's not acceptable to the society. And they immediately start body shaming, which gives a lot of low self-esteem and self-image, which impacts both mental health as well as physical health. The peer pressure of looking like Malika Arora Khan, even in age of 50, because she is looking beautiful, even I have to look that way. So, peer pressure. You have set up unrealistic body and beauty standards. So somewhere or the other, there's a distinct split that is happening between the body image and acceptance of me versus others. So there's a split about your own self. The self-hatred creeps in, and that gives the basic cause of all mental health disorders. Okay, this roots for all mental health care disorders. You may get patients who may not be there at depression, who may not be there at anxiety to diagnose clinical anxiety or clinical depression. But these things, if they are present in their surroundings, are the beginning roots of mental health disorders. Okay. And at this point, we need to treat them at a very beginning stage. We have to identify them and bring them into awareness so that we can prevent a lot of mental health issues, a lot of substance abuse issues. Okay. If we understand that these are the basic root cause of the problem, how do we validate? So I'll come to the therapeutic part or the therapy part or the mind counseling part later, but I first go to homeopathy. Now, homeopathy has a lot of potential to treat this, because if you see all of these things, all of these particular causation, for every of these we have remedies. We have remedies like silicea, sulfur, palladium, platinum, who are looking for a good word, good opinion of others. We have thujada, things that my self-image is so small and so fragile that it will be broken very easily. Varatrum album, we have a remedy that will squander money So if you have a patient with a very low self-image and wants to fit into the society and is squandering money behind cosmetic surgeries, behind all the cosmetic details just to fit in, okay, we know that's veratrum. Okay, so we have all our homeopathic remedies surrounding that. When you say trauma, we have so many ailments from grief, ailments from disappointment, love, ailments from unrequited love, okay, ailments from too much of joy, too much of sadness, ailments from betrayal. So we use this remedy. Delusion, wretched she looks, validation, unrealistic body and beauty standard. Okay, delusion, ugly she is. You have different remedies based on that, and we can then prescribe remedies according to it. Calcarea sulf, max sulf, nat sulf, all the salts of sulfur and silica you can think of when it comes to validation, and calcarea silicata. Okay, so all of these, somewhere or the other, we know the remedies are present. We have to identify that in patients and then prescribe accordingly. So I'll give you an example with a case of a very young student in her internship level who had come to me for her case, and her case started like this. Okay, a female patient of 25 years. She came with severe anxiety issues, and all the anxiety, very attached to her friends. And this attachment, she says, is leading her to anxiety and depression. Very sensitive girl, very beautiful in looking, but yet very sensitive, and yet with a lot of poor self image. She says she was fine, but since she has completed her college and entered the internship and the world of practice, etc., into the working mode, she's been, she feels that she's not enough. Okay, she feels that she's not good enough for the world, and she has been into a constant state of anxiety and depression. Okay, the issue, mainly the first time she experienced this, was when a very close friend of her, she felt, was being distant from her. Okay, she's like, this friend of mine was friend of me since my childhood. We lived in same neighborhood, we went to same school, went to same college, we went to same degree college. In schools, colleges, every part of my life, we were together. We were exchanging notes, we were sharing ideas, studying. Now life has happened. She has found her own way. She has a boyfriend, she has a life, she has her own career choices, and I feel, and she has taken certain decisions which are, which may not be in my capacity to fulfill, and they that's the reason why we have separated. So I feel the life that is happening now after college has caused a separation between me and my friend, and this gives me a complete panic attack. This makes me anxious, this makes me depressed. I don't know what to do. How do I function? So she says there had been a lot of fight. Okay, there's been a fight with a best friend, and she's like a friend of her life. And she says, I'm too dependent on her. Okay, when she's not around, I feel I can't function, I cannot go around. She's like a support system to me. Now she's getting so busy that she doesn't have a time to even WhatsApp me and ask, how are you? And this is bothering me a lot. Like somebody whom I spend 24/7 with, she's not giving me a time. And how do I live without her? She's busy. I understand. I'm happy for her that she has a boyfriend, she has selected a career, she's doing good, she's getting appreciated by people. That's okay. That's good for her. But don't forget me. I am more affected. So I said, what do you want? How do you think I can help you? So like, ma'am, if you can do something, can you help me with this aspect where I'm completely dependent on her? I feel that she has developed her identity, and she tells me, That, okay, listen, now we are grown-ups. I have my own thing to do. You have your own thing to do. Go find your own thing. But I don't know how to find without her. She can live without me. She's good. She's independent. She's gone. She's finding her life. But I don't know how to live without her. I feel I'm not getting the love that I have given her. I know if I'm in trouble, she will come back. She's always there. Like in between, I was not well. So she was there taking care of me and she helped me out. But now, when she's not around, my problem is, and when she's around me, I'm okay. But when she's not around, the feeling that she will not be, she's lacking in my life, makes me anxious and makes me depressed. She goes on a date with her boyfriend, I am anxious that she will not come back to me. When we are outside and she's chatting with her boyfriend, I'm like, oh God, I don't have a place in her life. She's not having time for me. I know this is not good enough because that will obstruct her life. And I want good things for her. But how do I function without her? I cannot function without her. Sometimes I feel like I am burden on her. I feel she should tell me where she's going, what is happening. She should inquire about my life, or like how she used to do in college time. She used to share everything. Then she's attending some professors' clinics and some professors' lectures, and she's not sharing with me. And why is she doing that? It's not that I'm jealous of her. I'm happy that she's getting best. But then why is she not taking me along? That's my problem. When since childhood till today, she was studying with me, learning with me. Now why not? And why I'm not getting similar opportunities, and that's bothering me. When I see her with others, I feel unlucky, unfortunate. There's no jealousy. There's a feeling of unluck, unfortunate. If she comes and shares, okay, today I was with so and so person, he taught me this, he told me this, that, I feel happy. I feel that she's appreciating me and I feel good. But when she doesn't do that, I go into my room and I cry. And I'm only crying whole day, whole night. Sometimes I'm missing like she had come to Mumbai for some extra studies, okay? So sometimes I feel that what experience I have come for, I'm missing that. Because all the time what I'm thinking is, why is my friend not with me? Why is there this lacking? I said, describe more about your life space, especially about your childhood. Now, major of the mental health issues stems from childhood. Okay. Some person, so while I'll just give you my thought process, that why so much dependent on this girl? Like we all have had friends in our life, in a school, a college, but we all grew apart also. And it was although we miss them, but we did let go. Why is this person not letting go of this girl? At a point, I even asked her, are you in love with this girl? Like, is there that, nowadays, not all are straight, people have different sexual choices. So she said, no, 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 that's not the case. She's just a friend. Okay. But then why so much dependence? So most of these, what I have seen is childhood builds a self-image, and people with poor self-image either had very oppressive parents, very restrictive parents, very dominating parents, okay, or there was a distinct split between parents. So most of the psychiatric or mental health issues, make sure you go to the childhood. Why is a person attracting a certain situation? Okay, that roots from the childhood. In therapy, we do a session known as inner child therapy. Okay, so when in most of the issues where it comes, where people are not finding success, not finding right partner, not finding certain things in life, not getting clarity in life, there is an issue in childhood. Okay, either the issue is in childhood which can give rise to different archetype. Now, this is a altogether different psychological topic, but I'll just give a very brief thing. So in childhood, two things can happen. The way the parenting has gone through, either they are over pampered, over strict, okay, or split between the parents, absent parents, okay. Now, this can give rise to different modified structures in the body. Either a person has so we all have masculine and feminine energy. Childhood can either break one of the energy, okay, traumatize the masculine energy, traumatize the feminine energy, create inequality of the energies, and create different archetypal structure, okay. So in most of such cases, we go to the childhood. And also in homeopathy, now this was from the therapy or the psychological aspect, but if I have to say from homeopathic aspect, even in homeopathy, the major characteristic symptoms you find in childhood, okay. In sensation method, when we are taking our cases and we do not find a common thread, and we feel we are stuck at one space and we're not going deeper into the sensation, the best way to tap into the deeper subconscious mind is going into the childhood, okay. So I asked her into the childhood what has happened. So she says that her mother has been epileptic since her childhood. So all the time, she had to handle a lot of her mother's illness all alone. And she had seen her mother in a very bad shape. Okay. Then when they grew up, her brother also left the hometown. Okay. And all her years of graduation, she was young, she was incapable, yet she had to handle mother's illness. And sadly, what happened, around the same time, her father also got hospitalized. Yeah, so there was back to back something or the other happening in her life, and she felt, I'm too small, I'm too weak to handle this. I'm not the person who can take up such big responsibility. So there should be some elder, there should be somebody who's senior who's taking care. Why me as a child is taking care? All I was doing, but I was not sure what I was doing. I was not liking the responsibility given to me. Okay, so the issue started with responsibility coming on a small young child, and she finding herself completely incapable. Then a year later, her dad had to undergo angiography, and the doctor came in and said, you have to sign this paper. And on the consent paper, it was written, we don't give life guarantee. And she was like trembling. She's like, how can I do that? I'm not big enough to take this life-changing decision. Why do I have to? I'm completely incapable. Alone. I'm a child. How can a child take this decision? So that was her main feeling. The child without a mother, that care is missing. Throughout my childhood, my mother was epileptic, so I missed the care, the nurturing, the love of the mother. And then she gave a whole womb experience where how mother takes care of a child, and she was not able to get it. Parents are supposed to take care of everything and everything, and you're not the person who have to handle everything. And here I am handling without any capacity. Okay. So what was your main experience over there? All alone, no one to support. I need someone to take care of me. Support that I get from my best friend. She's like my crutches. When we were small, she was that crutch to me. I need her. And now, right now, again, she comes back to her present situation and she says, I was missing that. Childhood, I used to see my mother always sick. So I was very shy, very timid. My father was also very strict. I had seen him beat up my brother. So my father, even if he gives me a look, I will cry. I'm very scared of, I love him, but I'm very, very scared of my father. So I feel the whole thing has shaped me up in such a way that I cannot be happy on all my own. You tell me to be on my own, I will not be happy. I'm always sad. At night, I'm constantly in fear that my mother will get fits. So when I'm around people, especially around this friend of mine, I think I'm happy. And I'm continuously anxious about my father, mother. So this friend is like a distraction. She gives me love, care, nourishment, support that I usually miss from my parents. At my home, I have to be the adult when I'm not the adult. I'm not supposed to be an adult. I don't have the capacity to be an adult, but I have to. I have no option, and that bothers me. Describe more about your nature. I'm very shy. I'm not confident in public right from the childhood. In school, colleges, whenever they will take a group picture, I will hide myself. Now, since the mobiles have come, I'm always the one who clicks the photo. I click very beautiful photos, but you will never see me clicking the photo. I don't dress well. I don't like dressing up like other girls. You will see me in this pant and this shirt always. Because I feel I look funny. People around me will just laugh at me. There's a constant feeling of embarrassment. Mostly I feel like a fool. I don't post anything on social media because I'm very sure or I'm scared that people will make fun of me. What will they say? What will be their comments? Will they like my photo? Will they not like my photo? So in my class, everybody has a boyfriend, but I'm always afraid to talk to boys. Will they like me? And I'll tell you, I'm not exaggerating. When I was looking at this girl and her statement, I was moved because this girl was simply so beautiful. She was fair like milk. She had beautiful eyes. She had beautiful features. But the innermost feeling was so much of embarrassment, so much of shyness, timidity that I'm not good. You know, what will people talk about me? And it took me a lot of sessions with her to open her up. And today, when I see her posting on social media, she's got married, she's having a successful clinic, it really gives a lot of pleasure because this girl has really opened up herself very beautifully. So this was this girl in her early 20s and with full of difference. So this is the case you have. Okay. Now what do we do? How do I approach this case? So I'm thinking, as the case is unfolding, I ask myself, who is this person whom I'm treating? What is the ego level? What is the id? How much her ego, her id has developed? What has caused this ego and id concept? I remember when I was working with one of my professors in gratitude with Dr. Mahesh Gandhi. He's a psychiatrist and a homeopath. And I used to attend a lot of cases with him. And he used to always tell me, if you have to understand a patient in psychiatry and the disease in psychiatry, you need to understand how far the ego has developed. And that's how our homeopathic remedies also come up. How far has this person developed? Or where is he stuck in the growth? Okay, that tells you the remedy as well as it tells you about the disease. Okay, what triggered? And often the id and ego, depending upon how strong it is, the causation will have an effect. And then you have an experience. And then you see how the person is coping up with it. Okay, so this is what is going on in my mind. So who the person is? She is a very timid person, very embarrassed. When her gesture, when she came and she was sitting with me, was always like this. She was never like this or relaxed or just talking. She was always like this in front of me. Always her body line. So sometimes people say I'm timid, but they are sitting like this. I'm timid. And they'll be talking to her like this, like this. They're saying, I'm very shy, doctor. And they'll be like, constantly making you feel shy by their behavior in the clinic. Okay. So I'm a very humble person. What do you think what degree you have? Acha. Doctor, I'm a very nice person. Huh? But you know what, doctor? I have been to best of so and so. I only go to best. I went to this oncologist. He was one of the best in Mumbai. He was international. How many international allocates you have? You see, he's talking, he's humble, but his body language is different. So here, there is no sync in what he's talking. What he's saying is jhoot. It's a lie. It's a big lie. Okay. So now you see the body language of this girl and what she's talking goes too much in sync. And you know that she shrunk herself. She has shrunk herself because she's conscious about herself. So she has a developed ego, but her identity and ego, she's living in too much of consciousness of this hidden ego. Okay, which gives rise to a lack of confidence. And then she's constantly feel that somebody's mocking, somebody's laughing, she's not good enough. Okay, so this is the person who's sitting in front of you. She's good, she's intelligent, she's smart, she can do things. Since childhood, if she's managing a child, mother's illness, her father's illness, that means she's capable of doing. But her experience is that I'm incapable. That's her deep down feeling, that I'm incapable of it. Okay, how I cannot do this, why am I doing it? Okay, so a cause is discord with a friend. Okay, the acute cause, the present cause is separation anxiety. All of a sudden the friend is going and I don't know how to function. I feel like a handicap without my friend. Mother's illness, the childhood, the root cause of a problem, I'm too little to take this responsibility. That's her experience in both the situation. In both the situation, if you actually see, she's talking the same language. That I cannot be on my own. I need you for support. If not every time, but at least when I'm in problem, I need you. Okay, that's her language. That's her other song. What's the experience? I cannot function. People will make fun of me and I cannot take responsibility. The issue lies in taking responsibility of our own self, responsibility of others. Problem starts there. Problem starts when there is a separation. Okay. So we need, what's my approach? I'm going to understand this case not by just the old school traditional method of keynote symptoms, of rubrics, or of materia medica. I'm going to mix the old and the new approaches in this case. Okay, because just with keynote approach, I cannot approach this case. I have to understand this through a wider lens. Okay, I have to see the holistic approach of this case. Okay, I'm going to use homeopathy in this case. I'm going to use a lot of therapies in this case. At different segment, I'll be using different therapeutic approach along with the remedy. Okay, so what is my first thing? The experience, she said. Sorry. So what is the first thing I'm going to understand is the system understanding. The main remedy, it's from Mineral Kingdom, row 6, column 2. Okay, I know it cannot be a single remedy, like a single metallic remedy. It's a salt. Okay, we have at one side the total feeling of incapacity to take on responsibility, total irresolutions, dependent on somebody else completely on one side, and another side there is a tremendous anxiety of being separated from someone. Okay, so I took this following rubrics along with my system understanding. Okay, and the remedy that comes in front of me is Baraita, Pulse, Sepia, Stramonium, Tarantula. Okay, now out of this remedy, I'm going to put a filter of my system understanding. Okay, and as I said, I need a mineral remedy. I need a remedy from 6th row where the problem is in responsibility. The problem is walking on their own legs. So when the friend is not there, she feels as if she's completely handicapped, she says, as if her legs are cut off. When she's out in the world, when she has to do presentation, when she has to talk, she feels people will mock at her. Okay. So my remedy selection over here is not pulsatilla. She is not sensitive like pulsatilla, not timid like pulsatilla. Okay. She's not indifferent like sepia, not scared like stramonium, and not vindictive like trirantula. She's somebody who wants somebody to support her, wants somebody to be her crutches. She said, she gave us that image, and I want to walk on the crutches. Okay. So to give her this remedy, I started in most of the mental, I could easily give her 1M, 10M, but in most of the mental health cases, in order to avoid aggravations, I start with 200 potency. Okay. And then slowly, if the need comes, I up my potency. If not, I just keep it at 200 to avoid any kind of homeopathic aggravations. Okay. So I gave her Baraita Carb 200, one dose, based on my understanding. And this was a follow-up testimonial after a year and a half. So I told you what I did homeopathically, and there are some exercises that I did with her on a therapy basis, okay, the healing therapy basis, okay, which include working with her. Number one is working with her inner child. Second was working through mirror work on her self-image. Okay. I gave her exercises where she was, after a certain point, the first homeopathic case taking was awareness. Okay. Homeopathic case taking comes with a lot of awareness. It creates a lot of awareness. And then the remedy helps you to let go of these tendencies. And once you feel the patient is ready for the change, is the time, in such cases, I introduce therapy. There will be some cases in which first I'll introduce therapy and then the remedy. Okay, but in her case, first I gave the remedy because there was too much of open wounds. When that was cleared up, I started with therapy so that she could disconnect, she could let go, she could cut the cord with a friend, she could cut the cord with a family, and then bloom on her own. Okay, so that's how. So there's this therapy known as mirror work therapy, which I do with a lot of my friends. It's a with a lot of my clients, and also with friends sometimes. So this therapy, it's a long therapy. It goes over for 2-3 months. Okay, and it brings up a lot of wound. And for her, I needed a lot of repetition of Baraita carb, not just one dose. Over period, I had to repeat it 2-3 times. For a month, I gave her just LM potency. Okay, kept her on an LM potency. When I thought that the therapies are now begin to change, I stopped the remedy. Okay, so in therapy, when I thought that she was more capable of taking, if any bad memory was coming up, she's able to heal, I stopped the remedy. Okay, and slowly and steadily, there was this improvement and the complete 360-degree change that I see in her after this whole process. So it was all 1.5 year game that we had to do with her. And obviously, even her efforts, you cannot see in most of the mental health cases, doctors or therapists cannot function alone. We are just facilitators. Unless and until the client or the patient has taken a stride to fight this, we are helpless. So I literally thank her for taking this journey and doing whatever I've told her over a period of time and worked on it. Okay. Because, like you say, you cannot clap with one hand. When you're treating mental health disorders, it's like you need both the hands to clap. You need the patient's participation and the physician. The physician or a therapist will just give a push. Okay. Dr. Manoj, do I have time or it's over? Or I'm up?
Yes, I think you have to finish now. Did you have completed the presentation?
Yes, almost done.
Yes.
Yeah. Okay, so I've timed it well. Okay, so this is how you deal with the impacts of the mental health in present day scenario. if we can catch hold of this at a very early stage like this, it's more easier. This, if not treated or just left unsaid or unshared, like even if there's somebody who sees the video later who's not a doctor, not a medical person, I feel when you see this early signs, I'm not saying take a medicine, but at least speak to a professional person. If you see somebody in your surrounding going through these scenarios, I will suggest, as a friend, you don't talk to them that I'll give you a therapy, or if your sister or your sister-in-law, somebody is affected, but at least suggest them to go to a professional. Sometimes they may not share with you because you're their relative. Mental
Yes.
health issues are very sensitive, but sometimes guiding them to a professional for seeking professional help is necessary. Obviously, we say healthy diet, healthy lifestyle, but when somebody is in a bad state of mental health, they will not pick up a healthy lifestyle. It's
Okay.
like suppression. It's like suppression. In my previous session also, I said using of positive reinforcement, lifestyle changes will not happen when the trauma is open. That will, when somebody is in that whole state of stress, you will have to first heal that stress and then take them slowly to a better lifestyle, and that's
Okay.
how you can function.
Yes.
Thank you.
Yes.